Coronavirus COVID-19 viruses are known as the simplest organisms that can reproduce themselves. It consists of a protein layer that surrounds molecules called DNA or RNA that carry only its genetic structure. Some viruses have a layer of fat surrounding it, called an envelope, such as in the new coronavirus. This simple microorganism does not have the ability to reproduce by itself. Viruses are obligate intracellular parasites. They have the ability to reproduce when they enter the cell called the host, which they have chosen uniquely. Viruses select specific cells in living organisms. For example, the new coronavirus is capable of being transmitted from person to person through droplets, as it loves respiratory tract mucosa. This period is called the incubation period because it takes a certain time for the virus to multiply and damage the tissues when it enters the respiratory tract mucosa. What does coronavirus mean? Coronaviruses, a type of virus, are named with the word corona, which means crown in Latin, since they are compared to a round crown with protrusions on the electron microscope, and coronaviruses have been seen in our society for years. The simplest and most common of these is the common cold. A group of 20 different types of viruses that cause upper respiratory tract infection along with a runny nose is coronavirus. Many other coronaviruses from the coronavirus family cause less severe illnesses with milder symptoms than the new coronavirus. For this reason, coronaviruses have not caused a major epidemic until now when it comes to diseases such as the common cold. From time to time, coronaviruses can switch between humans and animals. The genetic information of viruses varies due to the mutation of their RNA. Especially in surface proteins, it clings to the cell and creates changes in the proteins it uses to enter, escaping from the previously formed immune system, and can multiply faster and damage cells much more. Coronaviruses, which have evolved over time, like all virus types, have started to cause more serious health problems with flu-like symptoms since 2002. Coronaviruses are zoonotic viruses, which are at risk of transmission between animals and humans. It is thought that Middle East respiratory syndrome, known as MERS in the past, is passed from camels, and severe acute respiratory syndrome, known as SARS, from musk cats. Standard recommendations for preventing the spread of coronavirus infections include regular hand washing and cleaning with alcohol-based hand disinfectants or soap and water, covering the mouth and nose with a tissue or inside the elbow during coughing and sneezing, and avoiding contact with people who show these symptoms. The used handkerchief should be disposed of immediately. What is new coronavirus disease, COVID-19? It was first seen in Wuhan, China, in early December 2019, and the official name of the virus was determined as SARS-CoV-2, Severe Acute Respiratory Syndrome Coronavirus 2, by the World Health Organization, WHO. The World Health Organization uses the term COVID-19 to describe the disease caused by the virus. On January 30, 2020, COVID-19 was declared a global health emergency by the World Health Organization. On March 11, 2020, the virus was declared as a pandemic, that is, a global epidemic. What kind of virus is coronavirus? What are the symptoms of new coronavirus disease, COVID-19? New coronavirus disease is generally a disease with fever, dry cough and breathing difficulties in progressive situations. In addition to these, different complaints such as sore throat, headache, nausea, vomiting, diarrhea, runny nose, muscle joint pain, loss of appetite can be seen. While the disease does not cause any complaints in some young and healthy people, it may progress with a milder clinical picture in some people, but especially in people with diabetes, high blood pressure, lung disease, immune system disease, pneumonia that requires treatment in more severe and hospital conditions, pneumonia, acute respiratory failure, and renal failure, and in some cases it can result in death. How is coronavirus transmitted? The virus is transmitted by droplets emitted by coughing, sneezing, or even speech from individuals who are sick or not sick, and by contact with the eyes, mouth and nose areas of the hands after touching the surfaces where the respiratory secretions of the patients touch. The virus settles in the respiratory system. Studies have shown that people who carry the virus without showing symptoms and in the incubation period are also contagious. Coronaviruses are generally viruses that cannot survive for a long time in the outside of the body. However, on some surfaces, they can survive from a few hours to a few days. In which groups is the new coronavirus disease, COVID-19, more severe? It is observed that the new coronavirus disease, COVID-19, affects people over the age of 65, cancer patients, pregnant women, those with weak immune systems, hypertension patients, diabetics, lung diseases and people with additional diseases such as COPD. Although COVID-19 symptoms are rarely seen in children, it is observed that they overcome the disease with mild symptoms. What is quarantine? What is insulation? Quarantine may be used to temporarily keep and observe or monitor a region or place to cut off contact with other people in the community, of persons, goods or animals coming from the source, place, country, where the disease is widespread or with a suspected history of contact, although not diagnosed with the disease, to prevent the spread of infection. It is a health measure applied in the form of keeping the entrance and exit under the roof. In COVID-19 infection, quarantine is applied for the incubation period, that is, 14 days. Isolation is a method of separating patients diagnosed with COVID-19 or people in recovery from healthy people to prevent the spread of the disease. People in this situation can be taken into isolation at home unless they have health problems that require hospitalization. How does the immune system fight the coronavirus? When a foreign organism or substance enters our body, the immune system cells immediately perceive it and produce antibody proteins that will bind with this foreign protein in a full key lock method and neutralize it. Antibodies bind to foreign proteins, making them dysfunctional. For example, when the proteins that viruses use to enter our cells are rendered dysfunctional by the body's antibodies, the virus cannot hold onto the cells and the cell cannot enter. What are the ways to prevent the new coronavirus disease, COVID-19? Since vaccines to prevent COVID-19 disease are still under development, the most effective way to prevent the disease is to avoid exposure to this virus. Since the virus mainly spreads from person to person, taking very simple but important measures contributes greatly to preventing the disease. Washing hands frequently with soap and water for at least 20 seconds is one of the most important measures to be taken to prevent COVID-19. Hand washing should be repeated especially after touching surfaces, nose wiping, coughing, sneezing. Both bar and liquid soap can kill coronavirus, but the use of liquid soap is most appropriate to eliminate coronavirus and other infections, as it may be possible for other microorganisms to remain on the soap bar and survive for a while. If soap and water are not readily available, it is necessary to use a hand sanitizer with at least 60% alcohol. It is necessary to cover all hands with disinfectant and rub them together until the disinfectant dries by itself. Touching eyes, nose and mouth with unwashed hands should be avoided. Since the disease is mostly transmitted by droplets, it is important to maintain a distance of at least 2 meters, ideally to maintain social distance with other people, and to use a mask. In addition, if the person is not wearing a mask, he should cover his mouth and nose with a tissue or inside the elbow when coughing or sneezing to protect others. This handkerchief should be thrown away immediately after use and hands should be washed immediately. Is new coronavirus disease, COVID-19, transmitted from cats and dogs to human? There is no evidence that the new coronavirus has been transmitted from home-cared pets to humans. However, it is recommended to wash hands with soap and water after contact with animals to avoid other potential risks of infection. Is the new coronavirus disease, COVID-19, transmitted by food or drink? According to the data obtained so far, no contamination from food and beverages has been observed. However, it should not be ignored that food and beverages bought from outside may contaminate them or their packaging. For this reason, these products should be kept outside for a few hours if possible and cleaned before using them. Is it effective to use bleach or vinegar in house cleaning against coronavirus? Vinegar does not have a lethal effect on coronavirus or other viruses. Bleach is an alkaline product, and when used in cleaning, it will help neutralize viruses, especially coronavirus. How to do house cleaning against coronavirus? Surfaces touched against coronavirus should be cleaned daily with soapy or detergent water and disinfected with alcohol-based or household disinfectants containing diluted bleach. Examples of these surfaces include mobile phones, computers, tables, door handles, buttons, countertops, handles, telephones, keyboards, toilets, taps and sinks. Does cologne kill coronavirus? Cologne, which contains 60% or more alcohol, can be used as a hand disinfectant against coronavirus. With alcoholic cleaners such as cologne, hand cleansing can be achieved so that the fingers, the inside of the palm and the upper part of the hand are evenly contacted for at least 20 seconds.